Hi, I'm Jon S. I'm a general surgeon practicing at Dublin, Jerome, Human Anatomy General Hospital. The gallbladder is essentially it stores bile. Whenever you eat a fatty meal, the gallbladder will contract and give you a little bit of bile into your system to help break down the fats that you eat. And then it helps them get absorbed. Liver makes bile and it secretes it down into the common bile duct into your intestines whenever you eat food. But whenever you're not eating and you need bile to be stored in the gallbladder, that's where it goes. And we get a little bit of extra bile secreted into the intestines whenever we eat a fatty meal. The gallbladder is not absolutely necessary because the gallbladder only stores bile, it does not make it. So what happens is when someone has their gallbladder out, the liver will continue to make the bile and it will just secrete it directly into the intestines. And the common bile duct ends up getting a little bit bigger over time when you don't have a gallbladder, and it serves as the function of the gallbladder. Well, a gallbladder attack, also called a biliary colic or symptomatic cholelithiasis, is essentially a feeling of pain in the right upper quadrant or the epigastric area, which is kind of the upper abdomen, and it results in pain right after you eat usually a fatty meal. What happens is you have gallstones, and a lot of people have gallstones and don't really have problems with pain. It's only the select few who actually have these symptoms of biliary colic. And what happens is these gallstones get caught in the cystic duct, which is the exit way from the gallbladder into your common bile duct and into the intestines. And if a gallstone gets stuck in there, periodically it causes these little episodes of gallbladder pain or a biliary colic. Yeah, sometimes it can be confused with a heart attack because the pain is in the upper abdomen, lower chest. People can report to the emergency room and say they have a pain in this area, and they often get ruled out for a heart attack, and then they subsequently find out that they have gallbladder problems. So people who require a gallbladder surgery or cholecystectomy, removal of the gallbladder, are those who have symptoms because of their gallstones. Many people have gallstones and they don't have symptoms. It's not until those gallstones actually start causing problems. One of the big problems is biliary colic. This is where you're having symptoms of pain after you eat, usually after a fatty meal. This pain, which is associated with the gallbladder, is typically resolved after the removal of the gallbladder. But another type of problem is the gallbladder can actually get infected because of these stones. If one of those stones gets trapped in the exit of the gallbladder, it's called the cystic duct. If you have an entrapment of a stone in there, you can have a really bad infection. That could, lead to a lot of problems and make you very sick, and can require a removal of the gallbladder as well. Furthermore, if one of those stones from the gallbladder was to get trapped in the common bile duct, and before it exits into your small intestines, it just happens to overlap with the area where your pancreas drains. And if the pancreas, if its secretions are blocked because of these gallstones, it can actually cause really bad pancreatitis, and this could be life-threatening. So this is another reason why some patients will require to have their gallbladder removed, and it may not even be directly related to the gallbladder, but because of these gallstones, that could actually cause an infection of the pancreas. The surgery is performed laparoscopically about 99% of the time. The gallbladder, if it's not acutely inflamed, meaning you don't have something called a cholecystitis, you usually can do it quite safely with a minimally invasive approach, doing laparoscopic surgery. Even if it is acutely inflamed, we can still take it out laparoscopically most of the time. We do it through 4 small incisions. The biggest one is usually about the size of my thumbnail. But sometimes it needs to be a little bit bigger if the gallbladder is very large and full of large stones. The other ones are about the sizes of small eraser heads. So recovery after the surgery is, fairly well. People tolerate the surgery very well. They often have surgery the same day and are discharged the same day after surgery. The recovery entails pain medication for the first couple days. Most people don't need to be on pain medication for more than a week because the incisions are small and they do quite well. They can resume a normal diet immediately after surgery.